Dr. Ashok Seth, first, the issue that really comes up is, are we supposed to be in a bubble kind of a situation? We're talking at a time when London has just gone out into a lockdown. Dr. Anand Ranganathan is very upset about the fact that there was a lockdown. Could we have kept our numbers the way we have? If there was no lockdown, could we have protected a large population of this country of 130 crore people plus safe with such 7.6 reported corona positive cases if we had not gone in for a lockdown? Could we have mitigated the disaster that was waiting to happen if we had not gone in for a lockdown? On one level. And on the other is that he's still asking people to be cautious because we're still a while away from a vaccine coming in. Until the vaccine comes in, it is time to remind people that you're going back to normal business, to markets, to workplaces, to a little bit of visiting here and there. You can't let your guard down. Is any of this misplaced, Dr. Ashok Seth?
Thank you very much. And I'm going to address this. I'm an apolitical person. I'm a doctor. And I'm also a citizen of India. Now, very clearly, let me address your second point first, which is, was he correct in repeating the cautions that we've been repeating numerous times over the last few months? And yes, absolutely. As a citizen of India and a doctor, I confirm the fact that it was important. You see, we are at a very delicate juncture. It's not the same as a few weeks ago or a month ago. We actually start seeing a situation where the number of cases may actually be decreasing at the wrong time, when the impending doom may actually be ahead of us with the festivals. And if people were to let their guard down, mingle with each other, avoid or forget any of the cautions, the number of cases could increase fivefold. We know that. The statistics tell us that. When we talk about this peak gradually coming down and flattening, it's only related to the precautions that have been done till now and could be done by individuals for the future, which is wearing masks properly, which is hand sanitation, which is distancing, and which is avoiding too much closeness in closed spaces. So I think Prime Minister, as a citizen of India, I'd say, as a doctor, as a citizen of India, he's been always connecting with the people, be it Man Ki Baat, be it the messages he's been giving, and there is a connect. So when it comes from the leader, at the right juncture, it reminds us about the importance of these things in the next few weeks, which is far greater than any other time. India can beat this and flatten the curve if we can actually pass the winters and the festive season, which is coming, properly and carefully. So that is the first point. Now, addressing the second point, which you said, which is the first point, what you said was, did we actually do the right thing in lockdown? Believe you me, the images you saw in Italy, coming from Spain and coming from United States in February, March, April, showed numerous deaths, inability for people even to get to the emergency, number of people on ventilators and dying, and a 2-mile-long queue to the cemetery, mass graves and mass burials happening. With the congestion and the population which exists in India, if those numbers had to be extrapolated to India, it meant crores of deaths, not even lakhs. It meant overwhelming of an inadequate system. It actually meant that even gynecologists and everyone would actually be treating COVID, and the healthcare, in fact, everyone would suffer in this country. Clearly, at that time, what was needed was a lockdown. It gave us time to think through. It gave us time to understand this virus as more data came out about the virus. It gave us time to build the infrastructure.